Hello, Dr. Doug Wyland from the Steadman Hawkins Clinic of the Carolinas. Today we're going to talk about ankle sprains and chronic ankle instability. Ankle sprains come in all flavors. There's mild, moderate, and severe sprains. Let me go through some basic anatomy so that we can understand some of the terms we're talking about. I'll show you the ankle model and the ligaments on the outside of the ankle. When a person turns their ankle, usually they turn it inwards like this. And as you can see, when the ankle turns inward, the ligaments on the outside of the ankle, which attach bone to bone, can stretch. The typical ankle sprain is when the ligaments on the outside stretch, they swell, and they hurt. Sometimes an athlete will hear a pop when they land awkwardly and turn the ankle. That pop sensation may be the ligaments actually tearing. There are three main ligaments on the outside of the ankle. There's the peroneal tendons here, the fibula bone, and the tibia bone. The actual ankle joint is this structure right here. This is called the talus bone and the tibia bone. The ankle is the structure that allows the foot to move up and down in this direction. And then the ankle also turns in and out through the joint below the ankle. So back to the ligaments that were injured. Oftentimes, a mild or moderate sprain involves stretching or partial tearing of the ligament. Let me show you another way. If my fingers are the ligament, a grade 1 sprain would be a stretching of the ligament. Grade 1. Grade 2 is a partial tear of the ligament. It could be a low grade 2 or it could be a high grade 2 tear. And a grade 3 sprain would be complete rupture of the ligaments. If we have a mild sprain, grade 1 or grade 2, most of the time we'll treat that with rest, ice, compression, elevation, kind of the standard of care for an ankle sprain. We like to get the swelling down, then we start range of motion, and a rehabilitation process carries on, usually lasting anywhere from 2 to 4 weeks. If it's a severe sprain, then it could last a little longer, and that may warrant further diagnostic images, such as X-ray or an MRI. Most sprains are of the mild to moderate type. They come about by the ankle turning, the ligaments stretching just a little bit, and a person can recover from a mild ankle sprain anywhere from 2 to 4 weeks. Sometimes the swelling remains, but through the course of a rehabilitation process, first, minimizing swelling, second, gaining range of motion, third, gaining strength, and then the last is gaining what we call proprioceptive capabilities. And that's where the athlete, for instance, learns how to get back onto the field. There are some situations where a person has multiple ankle sprains and does not recover very well. In that situation, the ligaments haven't healed properly or they're too stretched out. Even if the strength is good around the ankle and the bone and the cartilage is okay, sometimes the ligaments are just too stretched out, and the person has a sense that the ankle gives way easily. This will oftentimes happen, and a patient will complain that their ankle gives way on uneven surfaces, such as a rocky driveway, or stepping off a curb awkwardly, or an athlete will say they just don't feel secure with their ankle, and it gives way easily. When we hear those complaints, oftentimes they're combined with, "My ankle hurts and it swells all the time." Most of the time, the swelling will take place in this area here. This is called the anterior lateral gutter of the ankle. That's the area that really displays the swelling the most. If there's swelling in an ankle, then we worry about other structures being injured in addition to the ligaments. Let's talk for a minute about the other structures that can be injured for a person that has chronic ankle sprains. The other structures that can be injured can be the cartilage of the talus. Cartilage is like a Teflon coating, and if a person continually turns their ankle, then the Teflon coating can get bumped and bruised and sometimes can wear and peel off. That's called a cartilage lesion. Sometimes the bone can be injured, and that would be an osteochondral injury. A person that has chronic sprains may develop spurs across the front of their ankle. And you may see that on a plain radiograph and oftentimes on the MRI. Other things that develop from chronic ankle sprains are something that we call synovitis, which is the lining of the joint is very inflamed and red. Oftentimes that'll be present over here. So chronic instability comes with it pain and a sense of giving way. When we evaluate a patient in the clinic, we'll ask the patient to move the ankle up and down and side to side. We're trying to get a sense of the strength about the ankle. Most of the time, the person has strength that's normal. The real problem, however, is that the person's ligaments here on the outside are too stretched out. We'll test that by doing something called an anterior drawer, where we move the ankle back and forth. If there's too much give in the ankle will slide too far forward and it'll turn too far this way. And sometimes that'll be painful. If a person's already gone through a rehabilitation process and has worn a brace and has not been successfully managed with a non-operative program, then oftentimes we will consider surgery. If we're considering surgery, then most times we'll obtain an MRI study. An MRI study gives us the ability to evaluate the cartilage surface, to evaluate the ligaments, the tendons around the ankle, any of the other structures that could be collateral damage to this chronic instability. After we obtain an MRI study, we'll speak with you about the findings, and we'll create a pathway which best suits your ankle. Most of the time, if a patient's young and they have healthy tissue, such as the ligaments here, then we can perform a procedure, surgical procedure, which is a direct repair of the ligaments. Think of the ligaments stretching out, once again, as a piece of taffy. If a piece of taffy were stretched out in the middle, the ends of the taffy would be just fine, but the middle would be stretched out. That's what I want you to think about the ligaments here. What we do with a direct repair of the ligaments is we cut out the bad stretched out portion of the ligament and we tie the good portions of the ligament back together. We do that through a series of sutures, and then we oversew the repair. That's called a modified Brostrom procedure, and it's very successful. 90% of the time, a patient will be able to recover, and they'll have restored ankle stability. Sometimes the tissue is low quality, however, and that stretching of the ligament has left us with nothing to work with. If we don't have much ligament to work with, then we need to actually rebuild the ligament, and that's called a reconstruction. When we reconstruct the ligaments on the outside of the ankle, we have to drill holes into the talus bone, the fibula bone, and the calcaneus here. We essentially weave a new ligament out of tissue. We may obtain the tissue from your hamstring, or we may obtain the tissue from a donor tissue. Essentially think of it as a shoestring that we weave new ligaments there to here and here to here. We'll still use the tissue that you have and we'll oversew that, but that's called a reconstruction. Both of those procedures work quite well, and both require about 4 months of recovery before you're back playing sports. Sometimes when we're repairing the ligaments, either a direct repair or a reconstruction, we still have to address the problems that have been going on chronically inside the ankle. And those are the cartilage problems, the spurs, and the inflammation. We have lots of different options for what we can do. We always perform an ankle arthroscopy. During the ankle arthroscopy, we can remove bone spurs, we can repair cartilage lesions, and we can remove the inflammatory tissue called synovitis and scar tissue from the joint. And sometimes there are loose bodies that we address. Oftentimes with this combined procedure, arthroscopic management followed by the open repair of the ligaments or the open reconstruction of the ligaments, the patient will have a successful outcome. Usual return to sports after this procedure, combining cartilage and ligament, is about 6 months. If it's just the ligament, then it's about 4 months. The last problem to consider if a person has chronic instability is to ensure that we evaluate how the person walks. If they tend to walk on the outside of their foot and they're constantly stretching out their ligaments, then we may need to add an osteotomy to the procedure to protect the ligament reconstruction. An osteotomy is a procedure we do where we actually cut the tibia bone or we cut the heel bone, the calcaneus, and realign the person's foot the way it lays when they stand. Once we correct the alignment of a person's ankle from this position to this position, then we perform the ligament reconstruction on the outside and any other cartilage procedures. Once the procedures are over, we go through a period of protection, minimum of 2 weeks up to 6 weeks, where we allow the ligaments to completely heal. We'll move through a series of range of motion in those first 6 weeks. That's really the first phase of therapy. It's protection and gentle range of motion. The next phases are about gaining strength, and then the last phase is about gaining sport-specific strength and proprioceptive abilities. We hope you've had a good education here about ankle instability and sprains and some of the problems that are related to ankle instability.